Thank you very much for joining us here. Good morning in Europe, middle of the afternoon here in Asia Pacific, and late morning in Middle East. Thank you very much for joining us. I'm joined here live in Singapore with Rosaline Chow, founder and CEO of CXA Group, one of the fast-growing insurtech, health tech companies here in Singapore. They've had a phenomenal journey over these last few years, ups and downs, lessons learned, and here stronger than ever. Rosaline, thank you very much for joining us here today. Pleasure as always to see you. Let's look at the last 12 months. Has this pandemic affected the long-term health and well-being of CXA?
It has tremendously. So during COVID, we found out that our face-to-face brokerage business could not grow. Clients could not leave, but we didn't generate new revenues. But our tech business, white label by insurers, banks, payroll companies, grew like crazy. So COVID forced us to make decisions. We sold off all of our brokerage businesses. We're about to sell off China. And we doubled down all the money into tech. As part of that process, I also got rid of all of our tech guys in Singapore and Vietnam and, double down on China, right? Because it was so much faster and more productive and more technical than everywhere else. So we went from 330 people, soon we'll be down to 20.
Wow.
As a pure tech business. So you can imagine what we've done in the last 3 months.
How is that as a mindset, Rosaline? Of course, you've got a business, you've grew it very successfully. Long term, some elements may or may not work as you want to grow them. But of course, you've got to make some hard decisions on where your future lies.
Yes.
How do you weigh that up as a business owner, as an entrepreneur? And then how do you pull the trigger inevitably on one of those decisions?
So none of the decisions were easy. The brokerage business, I used to run Mercer Marsh. So 75 people joined me from Mercer Marsh and Aon to build CXA. You can imagine deciding to sell that part off and the betrayal, right? So that was not easy. It wasn't easy to tell the team either, but it was a necessity. So I would compare it to ripping out your heart to save the body, right? And you cut off some limbs. So I feel like I used to think I was a cockroach that could survive any nuclear holocaust, but now I think of myself as a lizard. You can regenerate your organs and your limbs over time because you need to save the body, right? And COVID forced us to make that decision. But now we have 20 people. We have a pure tech firm, but we white label for insurers and banks for all their commercial banking, retail, high net worth clients. I don't have to chase after SMEs or corporates one by one, right? Each deal in each country is huge. So I have to be able to replicate this, but that was a hard decision. It's still hard decisions. It's hard to, cut 100 tech people.
What specifically wasn't working when you were looking at something like the Vietnamese operations, which I'm sure in time could have done okay, but the question always remains, could those resources be better put somewhere else? What wasn't working in Vietnam that you thought would work better somewhere else?
So the Vietnamese team did a great job, but when we had to decide during COVID, right, how do we lower costs and still get as much done? So China works 996. I actually think they work 9 midnight 7, right? Because that's the culture. And there's depth and breadth of talent. Whereas in Vietnam, it hasn't been a tech hub for that long, so you don't have the depth of talent, but also you have to pay for overtime. So when you add that up together, right, you don't have senior talent. You have a lot of great low-level talent, but if you have to pay for overtime and you don't have senior people there, then what do? You have to have language issues in multiple countries. So why not consolidate it all?
Now you've doubled down in tech, and obviously you've left the brokerages away, which is exciting. I mean, obviously this is a really exciting place for you and the company to be going forward. What are the plans for the tech, the platform going forward? Obviously you've always got iterations you can make, but you're now in a very comfortable position where you've built the tech,
Yes.
it's good to go, it can be distributed and deployed. What's your feelings at that at the moment in time? Is it all now about the right partners and getting that technology into the right partners?
That's exactly it. So last year during COVID, we deployed in 4 different countries.
Okay.
And in every different country, we build a benefits wallet, right? It pays for insurance, but if you're married to someone and they have family coverage, you want to free up some of that money and pay for wellness and fitness and mental health and nutrition or early detection. So in every country, we swap out the insurer, swap out the language, the currency, but then we integrate different clinics, different teledoc, different health screening, different fitness providers, right? Mental health, diabetes. So we think the core is done. And all we're doing in every country is plug and play, integrate different local providers. Because in every country, there are insurance companies and they distribute through partners and we connect everything into one app. So we think we're ready to go global and we can always add people, right? But how do you strip yourself down to a core foundation where health and wellness is paid for by your employers and it pays for all these different things, being sick, but also getting healthy. So that's how we see it. We think we're ready to go global.
Where do you think the future of health and well-being is when it comes to your your part in the ecosystem? Do you believe it's telemedicine? Is it wearables? Is it tracking? Is it diagnostics? Where do you think, where does CXA fit into that, and where do you think you're going to be investing most time and effort? Or is it a country by country difference?
So we focus on employers because we think that company-funded money could pay for lots of things, right? If you free up that treatment money for wellness and health, then you have to be the whole ecosystem. It's not just teledoctor. Sometimes you have to see a doctor. It's not just wearables. You actually want to go into the gym and do Pilates and yoga. You want to have a trainer. So to me, it's offline and health and online. And it's a pre-funded wallet that pays for what you need. So CXA, I view us as the menu of options. Here's your wallet, and here are all the things it can pay for. And when you run out of your wallet, you can use your credit card. Yeah. But if you have thousands of dollars in your wallet to get healthy, right, and your employer will give you more money if you lose weight or stop smoking or improve your diabetes, it's holistic. And so we see ourselves as the money and the ecosystem. So we see ourselves connecting this fragmented network of doctors, drugs, early detection, wellness, fitness, mental health, disease management. So we just have to connect and build the ecosystem.
Let's look at it from 2 different angles. I'll come back to the actual employer itself. Let's look at the employee.
Yes.
Many of which have been, I suppose, latecomers, a little bit skeptical of using health tech, or maybe of understanding how they can properly leverage employee benefit, employee health programs.
Yes.
How do we get employees across any industry, any country, how do we get greater adoption levels to understand that these benefits are there? The platform's there, the tech's there. How do we get them to start using that?
So there's an issue of trust, right? So employees are always worried, will my employer see my health, right? Will they see what's wrong with me? And until you get the encryption of the data and that trust there, no one really wants their employer to see their health screening results or that they've been diagnosed with some disease. So I think we have to get across that first. Once you get across that, because the technology is available to integrate all these components. If it's useful and there's trust, then you will see adoption. So where we've seen the most adoption is in China. We have about 1 million users in China.
Wow.
And we help them with their insurance, their health screening, to see doctors, to see specialists, for telemedicine, and for wellness. So we see it all across, but China's more advanced in terms of, sharing data and using apps and going cashless.
Yeah.
So we think where China's gone, the rest of the world will go.
Yeah, interesting. I know there's the e-wallet, the pay wallets. They're here in Singapore now, but quite an early stage.
It's early stage.
Early stage, yeah.
Whereas China bypassed credit cards.
Yeah.
And cash, right?
Yeah.
No cash, no credit cards. Every Chinese that come here or elsewhere think it's so primitive, right? Because you have to get cash and credit cards. Your e-wallet doesn't work. But in China, we see something very different. And it's not just insurance and health and wellness. We see it converging with lifestyle and wealth. So we're seeing a convergence of health, wealth, and lifestyle, all converging into one. And employers are helping their employees get over that trust issue because the apps are really useful.
Let's look at it from an employee's perspective. I think CXA, when they initially were first started, were dealing with a range of companies, from SME to large MNC companies. You were one of the first people, Rosaline, to try and develop corporate wellness solutions for everybody. You've been chapping on every employer's door to try and be advocates for corporate wellness, employee health, employee well-being. Yep. Is this the turning of the tide? Are we finally seeing mainstream employers now coming round to investing into their employees' health and well-being? Or is that still a slow ship that's turning?
I still think it's a slow ship. And the reason why is because the largest corporates would do it. SMEs are still not doing it because they barely have money. I'm an SME, so I know, right? So you do what you can. For example, the large corporate used to buy devices for the step challenges. But how do you get devices to employees who are remote? So we see step challenges moving to taking the steps off the pedometer. Yeah. And we're seeing Instagram pictures that you can post so that you can see your colleagues, not on Zoom, but at least exercising. Of course, in Asia, there are lots of food pictures, not healthy foods, just food. Right? But we are seeing large corps do it, and smaller companies are starting to, because when the economy starts picking up again, it will be a talent war. And once there's a talent war, everyone will need to do something for their employees to keep them. Yeah. And benefits is one way to differentiate, especially if you care about their wellness. So we see a slow burn, but we do see a lot of larger corporates do a lot. Mental health, physical health.
What are your advice to some of the smaller companies out there that are, for the first time, navigating this corporate well-being, this employee well-being marketplace? What should they look for? I mean, CXA might be a great fit. Something else might be a great fit. But I mean, you know the pitfalls. You know the opportunities out there. What do they have to assess to try and make the right choice for their employees?
So we're focused on SMEs because, to me, that's the future. Because large corporates will have a lot of money to spend. But SMEs have no money. So the only way SMEs can afford it if it's bundled with something else. So our deals with all the banks and insurers is that if an SME buys insurance from you, it gets bundled with all the wellness choices and the fitness choices. So for the price of buying insurance, you get all of this. So do all your employees. So I don't think SMEs will need to pay for this. Good. I think as they pay for their insurance, they get wellness and fitness and mental health all embedded in one. Because the tech is ready. It's just, are the insurers ready to move this way? And I think they are. COVID finally created the urgency.
Well, that's my next question, because I think insurers are one of these huge influencers in the health ecosystem, but they have traditionally lied on the outside, almost isolated from
Yes.
many of the other components. What does it take for us to bring them more into the picture? They have to engage, but of course we have to be magnets and give them something to pull to. How do we get more insurance companies to understand the benefits of working with such companies, of putting together such bundles, of on focusing on health rather than, say, life?
Yeah, so that's been our journey, and that's been our mission, is to convince the insurers that they shouldn't be there just when people get sick, right? They should be there to detect disease early and to help people get healthy, right? Otherwise, then their losses will be too great. So the only way to do that we found, is we have to build the insurance components, not just the wellness. We had to build the insurance distribution and integrate the insurance supply chain. And then in the manufacturing to actually automate the processing. So if we can take down the cost of acquisition and the cost of processing, then you have a business model. So it took us 8 years. We built the end-to-end. We built what insurance companies should have built, the whole thing end-to-end, and that platform is ready. And so we're hoping in every country we can get an insurer with their partners.
What do you think has been the reluctance of insurers to come to the table with more ambition, with more capital, with more flexibility to look at adopting and deploying these solutions? Do you think it's just not their game? It's never been their game. They've been asked to do something new. It requires people like CXA to come and create these solutions for them. Has that been the main stumbling block, or is it a case of an old dog can't train tricks?
So I think the biggest obstacle is that insurance started with agents. And so when you have an agency force, anything that can cannibalize the agents will piss them off. And so if you do something digital and it takes away the agent's, money, right? Then they will protest and they will kill that CEO. So I think it takes a huge amount of guts for a CEO of an insurance company to actually push for something digital on the side. Because you will piss off your bread and butter, right?
Yeah.
This is where all your money is coming from. So it's just how the insurance companies grew up. So you either have to be a new insurer, or your life agency force is not strong enough, or COVID showed you that no one wants to see your agents. So maybe now's the opportunity to build the digital tools. And you can start with building tools to enable the agents, but you still have to have other channels. So yeah, I don't think it's reluctance. It's your whole distribution force will be pissed off if you take away all their money.
Now, you're formerly with Mercer.
I formerly Mercer, but I also used to run an insurance company.
Absolutely, yeah. Let's have a look at some of these kind of brokers like Aon, like Mercer, some of the kind of advisors like Watson, Towers, William, for example. How are they adapting, do you think, into this new marketplace? Traditionally, they've been health, and
Yes.
now there's health, wealth, and well-being, etc. How are you working with them? Is there routes to partnership with these companies? What role will they have to play in this new health and wellness ecosystem?
So now that I've sold off my brokers, I guess I could. So earlier, I just took clients, or they took clients from me.
Yeah.
But now that that part of my business is gone, they could white label the platform.
Got it.
But they haven't built the integrated ecosystem. That's what it takes. You have to connect all the pieces. It takes a village to run healthcare, because it's not one thing.
What are your thoughts on the future of Singapore? China, as you work in before, it's coming out of this pandemic. It is already rebounding in many markets. It's great to see. It is probably the most digitally advanced or technologically advanced country in the world. arguably by quite some distance.
Yes.
What does Singapore future lie ahead? What do you think is the challenges, is the opportunities for the country?
I think Singapore will go down the same path as China, with us like one Chinese city, right? Singapore's pretty advanced. This is a great place to pilot, but I think any business has to be regional. It can't be just Singapore.
Okay, we've asked this question a few times today, Rosaline, but I'm going to ask it again to you. On business and then on life, what has the last 12 months taught you in the business? You are an accomplished businesswoman, accomplished entrepreneur, but you know, we all learn day by day. What have you learned in the past 12 months?
The past 12 months have helped me take a step back and really look at the situation. And I discovered I was further removed from the day-to-day than I should have been. Now with 20 employees soon, I'm back in the driver's seat, right? So it's great. I feel like I'm back to the beginning of the startup. You know, when you're in your living room, of course I'm back in my living room, you're in your living room and you're driving the day-to-day and things move really fast and you're just living with the bare foundation. So never let a crisis go to waste, right? Adapt, you know, or die, right? So we didn't die, and it's a miracle.
How have you found, obviously, you're now back in that kind of growth mindset with a small team. Is that what suits you better? Do you like that small, intimate group of people really driving forward?
I love it.
Yeah.
I love it. Yeah. I feel like I'm back to the beginning. And it's fun.
Good.
Right.
You can see the spark in your eye from it.
Yeah.
And then on life, what has the last 12 months taught you on life, Rosaline?
So I've spent time with both my kids, a lot of time, maybe too much time with my husband. So the family's back together, and I like working remotely, and I like the integration of work and home. So I like this new era.
One closing question, which I asked earlier on, I'm going to borrow it from a Tim Ferriss podcast, which was, if I had one billboard in the middle of a town that you could write one phrase or one word, what one phrase or one word would you write on that billboard for everyone to see, Rosaline?
Seize the day, right? Seize the day. This is our time.
That, ladies and gentlemen, is a very good place to end this conversation on. Rosaline, as always, an absolute pleasure. All the very best to you and the company going forward. Look forward to seeing all the good developments to come. And again, thanks for your time.
Thank you.
Thanks, folks. We'll be back in 1 minute with another conversation.